If I were interviewing you for a nursing job, these are some of the questions I would ask you.
You guys loved my interview questions, so I thought that I could answer them so that way you guys could see what your answers may or may not look like.
To start off with, can you tell me about yourself and your professional experience?
So I've been a nurse for 10 years, with the last 9 of those years being in the ICU. I have my master's degree in nursing education. I obtained my CCRN in 2018. And while I've been in the ICU, I have worked as a bedside nurse. I've worked as a preceptor. I've also worked as a charge nurse, both in the clinical capacity, like a resource nurse, where I'm hands-on, going to Rapids, going to Code Blues, as well as the operational side, where I do the staffing and bed placement for night shift and day shift. A little bit more about me is I'm also a mom. I have 2 kids, and we live very busy, active lives outside of work. We love going to the boat, we love going to the park, we love hanging out with our family and friends, and just being active in our own personal lives.
Tell me about some of your strengths that you can bring to this nursing job.
Some of the strengths that I bring to the table is I'm a very good team player. I can recognize when someone else may be, drowning in their assignment, and if I have the ability to go and help them, I'm very comfortable with just jumping in and helping them. I also love precepting, and have precepted for a lot of years. I love nursing education. I love evidence-based practices, and so I love when I get nursing students or new nurses on the unit that work with me, because I feel like I can really help build and grow them in a very foundational way. I also feel like with all of my nursing experience, I'm very comfortable with talking with providers, with advocating for patients when I recognize that something might not be right, and collaborating that with the team, with the provider, with whoever I need to address the situation.
Tell me a time where you made a mistake, what you did about it, and how you handled it.
One mistake I made a couple years ago was actually when I was changing a patient's port dressing, the dressing that was over their port, and the tape on the original dressing kind of got stuck to the port's line. And so I was using scissors to, try and get that tape off so I could go ahead and place the new dressing. And unfortunately, I accidentally cut the tubing that was coming from the port. So we had to remove the port and replace a new one. Luckily, the patient was really kind about it. I explained to the patient what happened. I called the provider, let them know what happened, and we got the okay to go ahead and obviously take that port out and insert a new one, and all was well.
Tell me about a time where you had to advocate for a patient.
There was a time that I had a patient that actually had downgrade orders to get out of the ICU and go to a telemetry floor, and overnight the patient went from being on a couple liters of oxygen to requiring a lot of oxygen. And even though they weren't quite meeting ICU criteria, when the provider came around, I explained to them hey, I'm really concerned about this patient downgrading. They've increased their oxygen requirements. They're a little more short of breath when they're getting up and moving, and I'm just concerned about their respiratory status. And luckily the provider was really receptive to it. They were okay with the patient staying in the ICU, and we actually ended up intubating the patient later on that shift, and the provider came back and thanked me and said, hey, thank you so much for sticking up for this patient, because if we would have downgraded them, this could have been a way more emergent situation.
Tell me about a time where you went above and beyond for someone.
One of my favorite things to do with ICU patients is help assist them with their hair. A lot of patients, when they have long hair and they're laying in bed for a long time, their hair just gets kind of ooey and matted, especially if they've had a trauma or, some sort of procedure, EEGs, all the glue. And so I love, giving my patients an ICU spa day, as I like to call it. I like to do the shampoo cap. On my last unit, we actually had hair supplies, brushes and conditioner and all that. And so, of course, with the patient's okay, the family's okay, I will use, some of those products to get the mats out of their hair, brush through their hair, braid it. That way their hair is protected and saved, because I have seen patients that have had such bad mats in their hair that they've had to have their hair cut or shaved. And so I like to do what I can to, just provide that little extra TLC to patients and make them feel special.
Tell me about a time where you had a conflict, whether it was with a coworker or a patient, a provider. What was that situation and how did you handle it?
My last job, we had a provider that was very well known for their very specialized procedures. They were also known for being a little bit of a hothead at times. And I had a patient that had a new trach, and the provider was rounding, and the provider was really upset by how, the dressing had looked, how this, trach had been maintained. They were pretty condescending towards me as the bedside nurse. And so in that moment I said, hey, let me get the respiratory therapist in here so we can all, take a look at this trach site. We can all be on the same, plan, on the same page as far as how you want this trach site maintained. And the provider was receptive to that, and we were able to get it, all fixed. But in the moment, they were pretty harsh towards me, and the patient and the family even recognized it. And they're like, "Oh, I'm sorry. They were, that provider wasn't super nice to you." And I was able to say, "You know what? I'm glad we got it all situated. We got everybody on the same page, so that way we can make sure we're doing this right in the future."
Tell me some areas that you're wanting to grow in.
Areas I want to grow in as a nurse are being more involved in my unit and, maybe some committees and, working on some of the best evidence-based practices for our ICU. I, love evidence-based practices, and I love implementing them and finding, creative ways to help nurses get on board with evidence-based practices. And so that's an area that I would love to grow in and see myself, growing into in this position, is helping, maybe initiate some of those new practices or, revamping some old things. Okay, I hope that was helpful. Hearing some of my responses. Obviously, your responses might look similar, they might look different, but I think it's helpful to hear other people interview because it always gives you new ideas on what to say, how to say it, and all of that.